Hey there, good morning guys. This morning we're going to talk about low back pain. Super important because it's so prevalent in our society for a multitude of factors. So again, these Facebook Live series are for you, so please join when you can, ask questions, comment below, be part of the discussion. So even if you're watching on replay, you can hashtag replay and ask your question or comments. Or if you have an idea or suggestion for a theme for the upcoming weeks, you can leave that as well. So some questions I received were, what are the causes of low back pain, right? And this can be so broad. It can be anything from an SI joint dysfunction, so there's hypermobility causing excess friction, causing pain. There could be a disc thing, there could be the combination, there could be a muscle thing, a facet joint thing. Most of you know I had colon surgery. So it could, which has totally affected my low back thing. So, I mean, even if you don't have a surgery and you're having digestive issues or something's going on with your intestines, visceral system, that can affect low back pain, muscle imbalances, weakness, scoliosis. So, I mean, obviously going into detail on each one, trying to discern what is the specific cause for you or maybe your patients or clients. That's a whole training in itself. And actually, I don't mean for this to be a plug for trainings I'm doing, but I really do have 2 upcoming trainings if you're interested in this, whether you're a yoga teacher or a physical therapist or even a student of physical therapy. The first is going to be at the end of February. It'll either be a 1 or 2 day training. So you can, again, leave your comment below and, say, hey, I'm interested in a 1 day thing or 2. And I'm going to be doing this with Dawn Adelon, and she's the owner of Level 4 Physical Therapy just down the road here in Encinitas. And we're going to be talking about how to include wellness into a healthcare practitioner's services. So it's really great if obviously you're a healthcare practitioner or a student or even a yoga teacher and you want to work with a healthcare practitioner like in a clinical setting, then this training will be for you. And we're developing the curriculum right now, so please share. Would you prefer 1 day or 2? And that's going to be the last weekend of February. And the second training is with my good friend Ilya, and it's going to be a 100-hour yoga therapy training, and that is definitely going to go into a lot of the details that I'm talking about today. So what are the common causes of low back pain, and what are some things we can do as yoga teachers, as physical therapists, as healthcare practitioners, to address the whole person, right? And so that's what I'm going to touch upon today is, I forgot to turn off my notifications, got a phone call. So getting beyond just the physicality of low back pain. Obviously, a lot of the times there's a structural thing going on, but I think I touched upon this. No, I didn't last time. But there's research, right, about imaging of, let's say, disc issues, for example. So someone can have a major disc bulge and it's shown on an MRI, and they have no pain at all, right? No pain at all. They're living high quality of life, don't even know it's there, right? And then there's someone with like a teeny little disc bulge and they have a magnitude of pain and it affects everything they do, their quality of living. So why is this? And the only way as health care practitioners that we can address why someone experiences something differently than the other is to really individualize treatments and protocols. There's no cookie cutter way, there's no standardized solution or magical pill that says if you do this, this, and this, you're gonna get this, right? You have to work one-on-one. You have to listen to the person in front of you and try to determine the root cause, right? So that being said, I am gonna provide a little teaser of some things I do, I guess, which is really just the tip of the iceberg, but it gives you some examples to help you get started. In fact, a lot of you that I'm friends with on Facebook, I know you already know all this, so please share your comments, your suggestions. Some of you are a wealth of information yourself, so just share. We can start a community here. So that was a long-winded answer to the causes of low back pain. So the next question I received, again, touching upon the physicality, what happens, let's say you do have low back pain, whether it's an acute spasm or more of a chronic condition that flares up and goes away. What are some things you can do like right now to help relieve the pain? So 2 questions I received about this. One was having to do with the oils, the essential oils. What do I use? And then the second was yoga postures. What do I do in an acute or chronic scenario? So since we're talking about physical, I'll start with the oils. So a lot of you know, again, I had surgery and I've been relying upon these guys very, very heavily. I haven't used any narcotics, just arnica and oils to get through my surgery. So copaiba, right? These guys will help to support the musculoskeletal system and promote the healing within the body. So they're used for support. I can go into further details. If you just comment below, ask your questions, I can give a lot more specifics. Peppermint is another, and Panaway. So a lot of the times I either combine these 3 together. I have a dropper bottle behind me. I'll combine with coconut oil and I'll apply for a more diluted mixture. I use this a lot with my patients. Or you can layer them. I usually put Panaway on first, copaiba, and then peppermint. It is strong, but it really helps to support the muscles and what's going on. And the next one I also use is Deep Relief. So this one's almost gone because I've been rolling it on pretty much throughout the day. Because, you know, as I give this video, I'm like actually working through this myself, in all honesty, just to be vulnerable. I'm like trying to rest. You know, I mentioned this last week. It's really hard for me for whatever reason. This is my block. This is my work. I'm like addicted to doing. And, you know, so for a good days, I'm like, for a few days, I'm like really, really good. I'm really, really conscious. I rest. I give myself the healing space. And then I'm like, yeah, I feel great. And I like charge back in and overdo totally. So today I'm kind of paying the price for that for yesterday. So we're only human. So I'm just sharing my story with you because I think we can all relate. You know, if you've definitely overdone in your healing process, please comment below. So the other one I can, I'll mention that I've been using a lot and I use it frequently with my patients is Cool Azul Pain Relief Cream. So I'm actually allowed to say that this will reduce pain, it cools inflammation, soreness, that type of thing. So I can say that, woohoo! It's an over-the-counter cream by Young Living. So those are my go-tos that I use with the oils. And again, if you want, it's endless. You can do the combinations like marjoram. Oh my goodness, I don't even know where to start. Just message me or comment below, ask questions, and I can go into further details. So from here, we're gonna move into some restorative postures, which is, you know, a gateway to moving from the physical nature of providing the healing environment to more stepping into the deeper layers, supporting the emotional system, helping the mind to calm, accessing that parasympathetic response, strengthening the polyvagal response, which, you know, sets off the parasympathetic response and dims the sympathetic. All this sorts of things. Now, here's my disclaimer. I am not a techie person at all. If you're not a techie person, please hashtag below, not a techie head. So I'm going to move the video into a very raw, rudimentary setup for videoing. I need to purchase a stand, a little thing. I know I can get them on Amazon for my iPhone. So if you have suggestions on iPhone stands for video that work well, that's not gonna break the bank, please comment below, and I need to go purchase one. So for now, I'm using my yoga blocks. They make a pretty good video camera stand, but I apologize for the videoing. Okay, so I'm gonna take you with me. You're in my office, actually, my PT office. Okay, there's my yoga wall. And here's a chair, which seems kind of funny, you know, for low back pain, because, you know, in Western society, we sit a lot. And that's one of the common causes of low back pain is sitting. However, this chair is from the Iyengar lineage of yoga, and it's not, well, we sit in it sometimes, but not in the traditional sense at all. A lot of times we sit in it sideways or backwards and put our legs through it. There's all kinds of things that can be done with the chair. But today we're going to talk about it in more of a restorative fashion. So as a physical therapist or a yoga teacher, if we have someone that comes in with spasming and they're super acute, a lot of the times, actually, truthfully, I don't even schedule them. What they need to do is rest. If they're in the spasm phase, they just need to apply oils, apply, not at the same time, ice, or sometimes heat's appropriate depending on what's going on. And they just need to allow a few days for that spasming to reduce. You know, less is more, definitely in that type of scenario. But let's say, you know, a patient didn't really understand that and they were really forceful about trying to come in, because I have a lot of type A and I get it. I'm there myself a lot of times, as I said before. Then so you have someone in your office and they're going through a spasming thing. So the trick is very little movement, but also sometimes if you stay in one spot for too long and then you try to move, the spasming gets worse. So it's this combination of resting, a little bit of movement, maybe just to change positions, and then resting some more, and repeating that with whatever is going to help the inflammatory process calm down. So, you know, when we're in that fight or flight response, the sympathetic nervous system, cortisol gets elevated. That inflammatory process is on high alert. So all this kind of stuff is going on, which is good. That's going to help to promote the healing. It's part of our natural physiological response. But sometimes we get stuck in that sympathetic system, and that system kind of goes into this feedback loop of overdrive. So we have to shut it off at some point, because a lot of times with low back pain or a lot of other issues, it's a space issue, and you have to create the space, and that's getting rid of excess inflammation and reducing muscle tightness, all that sort of stuff. So again, restorative poses are a great gateway to help someone to get there, because I have a lot of patients that do practice yoga, but I have a lot of patients that don't practice yoga, and they'd like to learn how, and restorative is a very gentle way for them to get there. Or they want to start to learn how to meditate or begin a breathwork practice, pranayama, and these are really good setups for initiating someone into that. And for me, I don't like to sit when I meditate, so sometimes I'm in this position, supine. So This I learned from Judith Hansen-Lassiter a while back, and I mean, if you've ever come to my class, you've experienced this pose. She calls it Instant Maui. I think there's other names floating around. If you've ever been to my privates, you probably have been given this for homework at some point, but it really helps the low back to decompress. If there's any spasming going on, it helps it to recede. So typically, in an order of events, I would apply oils and then I would go into this posture. So all you're gonna do is you have a folded blanket, that's for the head, and you just put your legs on the chair. So again, I'll demo this. Obviously the videoing is not so great. And maybe if your mind is creative, you can probably see it. Again, I'm moving just very cautiously because myself, going through my own healing stuff right now. So again, the legs just go on the chair and the head goes on the blanket. And see, when I get in the pose, it feels so great. So that's one really, really wonderful posture to do for spasms, for that acute. And again, you don't want to stay there too long, especially if they're prone to spasms or in the acute phase, because when they try to move again, it can spasm. Have any of you ever experienced Instant Maui? It's a variation essentially of Viparikkarani, legs up the wall. It's just little less taxing on the hamstrings essentially, so that's what gives the low back a little bit more space to breathe. But legs up the wall, if you have the hamstring flexibility, is really great. However, it is a little bit much for the spasm acute phase. It's more good for the regenerative healing phase, so in a couple weeks it's a good next progression. So from there, there's a ton of poses that you can do. You can do supine with the legs bent, doing gentle auto traction. It's really endless where you can go from here. Again, it's hard to give specific postures because really the restorative posture or the yoga posture that I'll give someone is totally dependent upon what they tell me is what's going on and what their specific body needs. So yeah, sometimes just a pose called constructive rest, where you lie on your back and you have the knees together. You can bind the knees with a strap, and that helps the psoas to calm down, which gives the low back space, is another one. So another question I received regarding low back pain is why does it stay chronic, right? And what do we do in these chronic low back pain scenarios? Like, why does someone heal really rapidly from their disc bulge and another person? I have many patients that have had reoccurring back pain. Like, they'll go through a period of time, sometimes it's months, sometimes it's years of no incident, but I mean 20-year histories of low back pain. Why does this occur? When the body has this innate ability to repair and heal itself. I forgot what side of the camera the camera's on. Sorry, the phone. So what happens then, and how can we get out of this chronic pain scenario? And I think this is huge for our society these days, because sometimes as physical therapists, as healthcare practitioners, or even yoga teachers, right, we get very intellectual. There's so much information out there. There's so many things to do to help one person. We try to, just think it through and help our patient to just think it through from a very intellectual standpoint, which is needed. But sometimes it's just allowing the patient and giving them, or the client, giving them the space to heal. So providing them that space and putting them in a restorative posture, or giving them homework with a restorative posture or meditative practice to help that person go deeper within, to get through the layers, to go to the root root source of this cause of the reoccurring pain. So it could be patterns of thought, right? So they're always triggering a fear response or anxiety, and how their body responds is gripping through the low back. Or, you know, there's the whole neural circuitry from the brain to the muscles and our sensations and everything. Like, where I always compare it to a hiking trail, where if you you know, go out on if a trail is being used frequently, it's easy to see. It's blazed. It's easy to walk on because it's already blazed, and the more people that keep walking it, you know, it stays this nice, easy to find trail to navigate and to walk through. And that's like a pain pathway in someone's body, mind, that has had pain for a long time. That circuitry from the brain to the back, let's say, for example, and back from the back to the brain, is easy to navigate. It's their pattern, let's say. When something happens, that's what, you know, their brain automatically goes there, and the pain response is easy to find and easy to be set off, right? However, you know, you need to create a new trail. So it's like blazing a new trail. It's really hard to find. It's a lot of work. It's very uncomfortable to, you know, cut back the brush and the trees and all this kinds of stuff. And the same with the body. Like, to create a new trail is stepping into this place of unknown and discomfort. It doesn't feel right. It's not like it doesn't feel like the natural way. And sometimes as yogis, like, we're all about like tuning into listening to our body and listening to our mind and all this kinds of stuff. So sometimes when we blaze a new trail to create new movement patterns or new ways of thinking, it doesn't necessarily feel right or good. And so a lot of people stop. Right? They're like, no, this isn't the way, or they get scared, right? They don't know what's going to happen next. And that's where, as yoga teachers and healthcare providers, we can help someone through the space. Like, I'm totally going through it right now. Like, to step into the space of non-moving and non-overdoing to just allow my body to heal is very, very scary for me. And I have some people that are helping me to hold the space, and I'm really, really grateful for. We just have to teach ourselves and teach our patients and clients, like, it's okay to feel uncomfortable. It's okay to feel scared. This is just really new. And we have to teach them to seek deeper and listen to the inner voice of really determining what is best for them right now. But because if they're still long enough, if they're quiet long enough, like whether it be in a restorative practice or just sitting in their car, if they showed up a few minutes early to pick up their kid from school or something, like taking advantage of what's available to them time-wise or body-wise or whatever, then, you know, the answer will come. Like, yes, really what's best for me is to move into this scary place of the unknown and create new paths, blaze new trails, get out of my old patterned way of moving and thinking. And that's what we really can help people get out of that chronic low back pain cycle if we help to teach them new ways to move. I mean, truthfully too, another thing that's going on in our society is, like, someone's diagnosed with a disc bulge, for example, and then they have this label, right? Okay, I have this disc bulge, and they associate it with it. They identify with it. It becomes part of their personality. Maybe they get secondary gains from it because, you know, maybe as a mom, they're allowed a little bit more flexibility and the responsibility and chores they have to do. Or at work, right? They don't have to have so much pressure because, oh, that person can't do that because of their back pain, right? But how do we get out of this? Or the other thing is, the doctor will tell someone with this, okay, so you cannot do this, you cannot bend forward, you cannot pick up things. And so that becomes a new pattern of movement and thinking. And living almost in a scarcity mindset of things that they can't do, or fear response. If I bend forward, oh my God, I'm going to cause a spasm, right? But at some point you have to come out of that mindset, that way of thinking, and start moving and twisting and bending and lifting again, so you can teach the body that it's safe to move. It's safe to move in all these different directions, and hit the body up, and doing yoga postures in different ways, so the body experiences muscle strength in all kinds of variety of positions. And of course, this is a very staggered progression of healing, going from more of the restorative to more active, and then always keeping that balance of moving back and forth between the systems. But sometime, you know, we have to let go of that label of, you know, I'm a person that has a back issue. You know, I have this thing, and that's who. We can't allow it to identify ourselves. We have to seek deeper within and find out truly who we are as an authentic being, an authentic person. And yes, saying that I'm a person that has back pain maybe on occasion, or hypermobility, or like for me, this gene thing, you know, but not allowing it to define us, if that makes sense. And that's really what we can do as teachers and healthcare providers, is helping someone really step into their own space of who they are. And that just opens a whole other like avenue of ways of moving, of blazing new trails and such, because maybe it opens up a path of dharma, right, or a purpose that a person has been kind of storing within. Like maybe they have these thoughts, oh, I really have a passion for doing this, or I really want to help people this way, but I'm at this job because I get a paycheck. And it's funny, like you think like, oh, what does someone's job have to do with their low back pain? But I guess it's more accepted now these days, right? But if we're truly living our purpose, then we are, you know, studies are showing that we're a little bit more resilient. We have a better ability to prevent injuries in our body, or if we do get injured, because we're only human, right? If we experience low back pain, it's just part of life, then we have the better ability to recover in a shorter amount of time with more grace. We're not going to experience these huge ebbs and flows of happiness and joy, or no pain to like 10 out of 10 pain. It's more just rolling with soft waves that come and go with life. So anyways, that is all that in a nutshell for low back pain. Obviously, this conversation can go on and on and on and on for days ad nauseum. But if you have any additional questions, I'll scroll through. If you're watching this at a later time, please leave your comments, suggestions, and questions. If you really want specifics of things, please message me or comment below. I'll reach out to you. Again, there's a couple trainings that are coming up that I'm leading with my friends that will definitely move into some of the specifics of all this. And the chronic pain pathway, brain. I mean, the brain is the new frontier, right? And it's more than just the brain. It's the whole nervous system, I think. Then comment below. So I hope you all have a great day. If you have some suggestions for upcoming week's topics, then comment below. I'd love to hear it. Okay, I hope you guys have a great day. Thanks so much for tuning in. Bye.